what time it is. Marvin Devine, Hoover, Axel, and you know how we do. Yeah, I got the juice. Whip game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Hoover, way too fireable. When this joint drop, that is called the truth. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah, I got the
Good afternoon, good evening, and welcome. And I sincerely mean that, welcome to another episode of Kidney Hub, East Africa. I am half your host, Steve the Kidney Nurse. Thank you for coming on. Today, we have an awesome topic to talk about. And as you can see on the banner, this is our topic today: self-care management for patients with kidney failure. Now, you don't necessarily have to have kidney failure to listen to this podcast. You can take kidney failure away and put whatever chronic disease you're dealing with there. So if you have lupus, self-care management for patients with lupus, self-care management for patients with sickle cell, self-care management for patients with diabetes, hypertension, you get it. Now, I want to extend a warm welcome if you're watching this broadcast internationally, because this show was originally created to address the lack of education of kidney disease in East Africa. And here to co-host with me, as always, is Brother Moses Kennedy, also known as the Kidney Ambassador, coming to you live all the way from Kisumu, Kenya. So let's give Brother Moses, the co-host, VIP welcome. Brother Moses, what's going on?
How are you? Good
I am
afternoon.
awesome, brother. How about yourself?
I'm great. I'm
Great,
doing
great,
fine.
man.
Yeah, yeah.
It's good to see you as always. I know you have many challenges over in Kenya when it comes to uh, kidney disease, especially you yourself being a kidney warrior. How's everything going today with you, brother?
Well, we are struggling to make it. We are really struggling to make it. As warriors, the obvious that comes with it. So I want to say we are fine. All is well.
It's good to hear. Um, Brother Moses, today we're going to be talking about a topic that I think is crucial. And I mean crucial in this day and time that's happening in the world when it comes to kidney care. We know that there's a lack of education, a lack of resources, a lack of um, involvement when it comes to this disease. As I showed on TikTok, nearly 750,000 people here in the US are diagnosed with kidney disease, kidney failure. Now, I'm sure the numbers are probably the same or more in East Africa. Now, as more and more people, Brother Moses, that are diagnosed with this disease and put on dialysis, they may not get the necessary education or information that can help them adjust as what I call this new normal. Because once you get on dialysis, whether it's outpatient hemo, home hemo, or home peritoneal, right? Once that happens, that's the new normal until one decides if they want to get a transplant, continue with this treatment for the rest of their life, or maybe come off dialysis. That's why self-care management is a critical topic today when it comes to kidney care, because it's an important factor. Do you want to have anything? Do you have anything you want to say before I delve into this topic?
Absolutely. It takes self-discipline to basically navigate through all this, especially what we are about to share on this podcast live. Yeah. Back to you, Brother Steve.
I'm sorry, I was on mute. What I was saying is I had to acknowledge this brother if he's still here. And that's Jared A. Brown. Jared A. Brown has a sister-in-law that had disease, still does, but she had a transplant. And we linked up back in 2000, I think 17, 18. I remember when they posted that his sister-in-law got a transplant up in Boston. And she lived over in Saudi Arabia with his twin brother. And from that point,
Yes.
they started advocating. And then he, took a break. He started the Warriors Quest show. He's a very intricate piece in this kidney space online. So I want to acknowledge him. Thanks, Jared, for coming. He produced many shows. We went on to produce shows for Lisa Baxter and other kidney educational shows. And I hope he comes back. Seriously, I know life goes on and we all go our separate ways, but I hope that he does come back and do some type of show or be more involved in the kidney disease space, because we don't get paid for this. We got families, he got family. It takes time to create and produce. I just wanted to acknowledge Jared Brown. I love him like a brother. We had an opportunity to meet in DC when he came here with his wife. So that brother holds a special place in my life, especially when it comes to this. He's not just another person. But let's move on to this show, because it's very important, and it's not coping with dialysis, but it's self-care management for patients with kidney failure. Now, Brother Moses, when we're talking about self-care management, a lot of people may want to know, what are you talking about, guys? Self-care management. Now, self-care management is a central part of successful dialysis care. Now, while the dialysis clinic provides life-sustaining treatment, what patients do between treatments, your daily habits, monitoring and communication with the care team, strongly affect symptoms, complications, quality of life, and long-term outcomes. Now, what did I just say? Many people on dialysis, you go to your dialysis clinic and we provide the treatment for you and care for you while you're there. But what are you doing with your care between the treatments? Your daily habits, the complications or symptoms that you may incur, how you deal with them. How are you handling that? So we're going to be talking about patient-centered, a guide that we can share with you when it comes to dialysis patients' outcome and self-management, of self-care management. Now, let me tell you what the World Health Organization, what they define adherence as. They define adherence as the extent to which a person's behavior in taking medications, following a diet, and or executing lifestyle changes corresponds with agreed upon recommendations from a healthcare provider. So we ask, this show asks you watching the TikTok, how adherent are you? Do you follow your renal diet? Do you take your medications as prescribed? Do you go to every treatment? And do you stay for the full time? Brother Moses, is there anything you want to add to what I just said?
Well, well, um, um, we we are just going to categorize all those into different factors. I mean, into different subtopics, and then I know we'll proceed from there.
Okay. Well, let me redirect this question. How important is self-care management to you as a dialysis patient?
Well, um, it is one of the most integral part in managing a chronic condition. And as an individual, I take it very central. And these are matters very close to my heart that in most cases I really lay emphasis on, because away from clinics or treatments, how you take care of yourself, things like to do with proper hygiene, adherence, and so forth and so forth, are very crucial to a patient, not only just attending treatment. Yes.
Thank you, brother. I appreciate it. Now, let's get into this topic. People with kidney disease can live long and well. Despite the contrary, what people hear, oh, you got kidney failure, you're doomed to an end, or you don't live long. No. People with kidney disease can live long and well. Your day-to-day decisions have a big impact on your health. Because of this, you must be an active and informed participant in the healthcare process. You just can't sit back and let people tell you what to do. You must be an active and informed participant. You hear what I'm saying, TikTok, and the crowd watching right now? You got to be active and an informed participant in your healthcare process. You see your healthcare team, meaning the dialysis center, approximately 12 hours each week. 12 hours in total. That is just half of a day. The rest of your time, you are on your own. The process of dialysis can only do so much to improve your health. Dialysis only does so much. Okay? Now, on a day-to-day basis, you are in charge of your own health. Not Steve, the kidney nurse, not Brother Moses, not the dialysis center, not your doctor, but you. And you know that. Some people don't. The decisions you make on a day-to-day basis, the decisions you make have a huge impact on your outcomes and quality of life. So you go to dialysis and you're supposed to take calcitriol or Sensipar, the green pill, Cinecalcet, and you know it hurts it messes my stomach. You do that for so long, don't take it, refuse it, and the next thing you know, you got bone issues. That decision you made not to take the medicine over the long period of time had an impact on how you feel now. Experiencing bone disease, having pain, easy fractures, calcium deposits in your blood or throughout your system. That's why self-management is important. Brother Moses, did you want to add anything before I move on?
Oh, yes. Oh, yes. And basically, it runs what you have just allow me just to echo on what you've just talked about. That it really boils up on, or rather, the buck still stops with the patient, because you all in all, you have to take that proactive action towards your treatment. And this is a core value that I want to encourage every patient to embrace.
Thank you for that, Brother Moses. And again, we should be having like 30, 40, 50 people on this broadcast, because we know 750,000 people in the U.S. each year are diagnosed with kidney failure. But anyway, why does self-management or self-care management matters? Now, before I go on, I want to put up a comment again from Tabitha. Thank you, Miss Tabitha. Nurse from Kenya is interjecting and engaging, and we thank you for your unwavering support. Ms. Tabitha says self-management is very vital from drug, dialysis, fluid, diet management, care of access, infection prevention, and guarding your mental space. And she hit the nail right on the head. Seriously. Especially if you're in a space or a country that's lacking vital resources. So thank you for that comment, Miss Tabitha. Now, why does self-care management matter? It keeps treatments effective. Following fluid, as Miss Tabitha says, following fluid, diet, and medication plans reduces intradialytic complications. Now, like Steve, what does all that mean? If you follow your fluid and your diet and medication plan, it's going to reduce problems during your dialysis treatment. Complications such as low blood pressure, cramps, nausea and vomiting, and possible hospital visits. 2, and did she mention this about the access? Protects access. Simple daily checks. And I just talked about that, I think last week on my TikTok Live. How to check your access to look, listen, and feel. You're looking at your access. If it's in the arm, look, listen, and feel. You're looking for any redness, any pus discharge, any swelling, anything abnormal with your access that you normally don't see. That's the look. Listen. Get yourself, if you can, a cheap stethoscope from Amazon, wherever you're from. And if you can't afford it, you can always use your ear, but it's best to get your hands on one of these and listen. Put this part on the access, and what you're listening for is a continuous bruit sound. Whoosh, whoosh, whoosh. Now, if you hear a high-pitched sound that sounds like a teapot kettle, like whistling, that means you got some issues developing. And why would it be sounding like a teapot, like a kettle whistling? Because the access, say this the access right here, the blood coming through, the access is narrowing. So as it's closing off, the force of blood trying to get through is causing that whistling noise. See, the access, when it's open, blood is flowing through. When it starts to close, it's going to be hard to get the blood through. You're going to hear that whistling sound. So that's why self-management matters. Again, it protects the access. Look, listen, and feel. And then the feel, you're going to feel for the bruit. But the simple checks that I just said and precautions help prevent infections and the loss of your access. Self-management matters because it improves well-being, which is greatly important. The improvement of well-being, symptom control, exercise, and another one that Miss Tabitha said, mental health. Mental health care improve energy, mood, and independence. Also, self-care management matters because it empowers patients. Like Brother Moses. I know Brother Moses, I don't know, maybe 10 years. It's been a minute. And he's always advocated for kidney disease awareness, education, and advocacy in Kenya. Very empowered, because he saw the lack of education, resources, empathy when it came to this in Kenya. So again, empowers patients. Active involvement makes decision making easier and it improves communication with clinicians. Brother Moses, I know I said a lot, but anything you want to piggyback on or say based on what I just said?
Absolutely, absolutely. Just 1 minute. Let me welcome my good friend Tabitha for always supporting this program. And now, lastly, just as you've mentioned, for self-management really encompasses the expected outcome in terms of managing chronic illnesses, in this case, CKD. And now we've seen a scenario where a patient doesn't know even simple basics, like not taking a BP on their fistulas, their access, right? Or not taking good care of their catheters. So, I mean, it really complicates, even if the care team are such a dedicated team, it makes it more difficult. Brother Steve, I normally tell my nurses, my care team, that they should thank me because I'm one of their executive patients. In other words, I'm just referring, I'll let you know what is supposed to be done, what I haven't done. If I need to carry my lab works, I will do it, you know. So it even makes taking care of you, a warrior, quite more easy and flexible, Brother Steve. Back to you.
Absolutely. I definitely agree with you. Now, as we move on, I'm going to share four important going to share four important lessons one should know to learn, or one should know as a person living with chronic kidney disease. And then I'm going to give you some self-key management actions. Well, where else are you going to get information like this? Seriously. Because, again, more and more people are being diagnosed and thrust into this disease treatment and not getting any education in how to manage to deal with this in a positive perspective, to have quality outcomes. Now, let's start with these four lessons. Your illness is serious. Your illness is serious. There are still patients out there who believe they have the not so serious kind of kidney disease. If you don't believe it is serious, you will never make changes to improve your health. This can lead to more serious health problems. 2, your condition is already self-managed. Did you hear what I said? Your condition is already self-managed. Now, what do I mean by that? I'm going to tell you. Every decision you make throughout the day, let me repeat that. Every decision you make throughout the day, from what you eat to whether you walk or ride the bus, has an influence on your health. You are the most important individual in managing your health. Number 3, you have options. There is rarely one perfect way to treat a condition. There's not. In the case of kidney failure, for example, patients can be treated through different types of dialysis. Each type requires a different degree of involvement from the patient and length of time and frequency on the machine. Transplantation is also a treatment option. However, for our brothers and sisters in Kenya, transplant option can be challenging and is not so easy to get on the list as it is in the United States. One needs to understand the different treatment options available and look at the personal costs and benefits of each. Only you, not me, not Brother Moses, only you can decide if the benefits are greater than the cost. And number 4, you can change your behavior. Rarely do patients leave the doctor's office and immediately enact whatever change was recommended. The reality is that it often has to be enacted in a series of steps. Okay? Nobody expects you when you leave or when you leave this program and we give you recommendations that you're going to leave and make that change. The reality is that it often has to be enacted in a series of steps. Significant behavioral changes can be made by setting small goals, taking that first step, and figuring out what you learn about yourself along the way. Brother Moses, anything you want to say about the 4 important lessons that I just went over for people living with chronic renal disease?
I think you've exhausted it.
I'm sorry?
You've really exhausted the points.
Mm-hmm. Mm-hmm. Do you see yourself doing or involved in any of these 4 lessons that I talked about? Like, do you know, or have you came to a determination, or when did you come to a determination that your illness was serious? Did you know that your condition is already self-managed? You know about your options, and have you changed your behavior?
Well, um, let me answer it in this way. Yes, to the extent that there are several stages that one goes through um, as you begin to get sick, and I tend to believe that the first stage is that denial stage that you really do not want to accept that now this is the new norm and let me move on. So yes, this one may contribute to ignorantly uh, not seeing how serious this condition is. So at one time, I also took it personally, not to just to move on. And later on, as as you interact, you begin to go through the journey, then acceptance come in, and other flexibilities cripples in, and then you definitely now your health begins to improve. Yes. Back to you, Brother Steve.
Thank you, Brother Moses. I appreciate that. Now let's go over some tips. And then from there, we're going to talk about some key self-management actions. Now, again, where else, if you just started dialysis or your loved one, you're a caregiver, this should resonate with you to help you or your loved one navigate through this new normal. Seriously. Now let's start with the tips. First one, know all you can about your disease. Seriously. You should know all you can about your disease, whether it's kidney disease, lupus, sickle cell, polycystic, Alport syndrome. Education is perhaps as important to your health as getting your prescriptions filled. And the literature describes that education is perhaps as important to your health as getting your prescription filled. You know, Brother Moses know, and people watching, there's not a lot of educational broadcasts out there such as ours. Every week, talking about a different aspect of kidney disease or kidney failure. This is why it's crucial to disseminate our broadcast, to share it with your followers if you're watching, and have them share it, and then have them others share it. Because kidney disease is not going to stop today, October the 12th. After we shut down the broadcast, guess what? Kidney disease is still there. It's still there. So know all you can about your disease. Again, education is perhaps as important to your health, TikTok, as getting your prescriptions filled. Adult learning, let me repeat that. Adult learning is often self-directed. What we learn best is usually what interests or motivate us most. Let me repeat that. What we learn best is usually what interests or motivate us most. So if this doesn't motivate you, you ain't going to learn it. What do you want to know? What do you want to change or see differently? Also, what are your health care priorities? That's the main thing. What are your health care priorities? And then, what are your health care concerns? What are your concerns? Brother Moses, anything you want to share before I move on to
Absolutely.
the next tip?
Absolutely. Um, 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 there are good indicators that really drives drives one to love something, to have really that passion over something. So just like you put it, if you self-educate yourself, then you will be asking, what do I want to really know? What haven't I haven't known, and what is expected of me? So this is the gap that is really lacking in between knowledge and vis-a-vis warriors, because they do not want to learn, to embrace new ideas, new things, including even innovations and new medications. I mean, and such like stuff, Brother Steve. Yeah. So it is very important. It is very important to self-seek that which you want to know and to understand. Back to you.
Absolutely. Thank you, Brother Moses. I want to read a couple of comments. Sister Tabitha says, in Kenya, you need a donor who is a blood relative to give you a kidney donation. It's free, not for sale, and the donor must be willing. Now, you see the
Absolutely.
challenges that kidney warriors have in Kenya to get on the transplant list. It got to be a blood relative. It can't be like here in the U.S., a deceased donor or a living donor, somebody you don't know. And that's a big challenge. That's a big hurdle because it limits
Absolutely.
their options. Also, I want to thank Kim Moore from TikTok that came over to YouTube to support me. Thank you, Miss Moore. I truly appreciate you. Seriously. I definitely appreciate your unwavering support. And then Brother Lawrence from the UK, Brother Moses, had a transplant, I believe, several years ago. I could be wrong, so don't quote me. But Brother Lawrence, and then thank you for your support, because he know when I was on Facebook from the beginning, before this TikTok came along, and he's always supported me and been very positive of my information and content. So thank you, Brother Lawrence. But he says very interesting messages. Remember teenagers who parents control everything around them. A lot of young people don't even realize how serious their condition is. More parents need to educate their children of the condition. And that's true. At age appropriate, especially they dealing with kidney disease. Tabitha says deceased donor program is yet to start here in Kenya once everything is set. And that would be great. Not that it's happy that someone loses their life in order for someone in Kenya to get a donation, but just the process of another option that one may have. Now, if you go to a blood donor, a blood relative, and they say no, then you don't have no other option. And here, once they implement that deceased donor program, then they have another option to go to. Okay. Here's another tip. Use your healthcare team. Some of you may not want to because you may find that they're incompetent. But if you find that you have a healthcare team that you trust, use them as experts for information, tools, and resources. Just like myself. I tell TikTok all the time, and even on YouTube or if you watch it from Facebook, if you have a question, reach out to me. My methods that you may see on here on social media may be unorthodox or not in line to the grain, but I do what I need to do to try to get that message across and effective. But you can use myself, or if you want TikTok, you have Nurse Nick, you got Dr. Chidima. Your believe it's hers is Your Kidney Helping You. I may be wrong, don't quote me. And any other dialysis professional that's willing to share evidence-based information. But use the healthcare team as experts for information, tools, and resources, including treatment options and consequences for not following the recommendations. Then consider how these fit with your preferences for your desired state of health and outcome. What do you think about that, Brother Moses? Using your healthcare team as experts for information, tools, and resources, including treatment options and consequences for not following recommendations. And then consider how these may fit with your preferences for your desired state of health and outcome.
Well, your first line of information basically should be your care team. I know there are challenges where the care team are not ready to educate, to advocate, as opposed to I mean, just not doing it completely. And even if you seek help, that is with the reference to here in Kenya. Uh, as in, when you seek help, sometimes you are only given scanty info, but then if all will be well, then I tend to believe that the first line of advocacy should be coming from a care team. But with the challenges we have, especially here in Kenya, it doesn't happen that way. So perhaps, I know, Brother Steve, it happens where you are, but then this is where now this program comes in. Once you get empowered, you get kind of awakened to, now to seek knowledge. Doesn't matter now where you get it, but you seek knowledge so that wherever you interact with your care team, you interact with them in the basis of that reference, Brother Steve. Yeah.
Well said, brother. Well said. The next tip: one should feel comfortable negotiating with their healthcare team about their health plan of care. And what do I mean by that? Each patient is the expert in his or her own life. I repeat, each patient is the expert in his or her own life. Federal regulations require dialysis facilities to invite patients to participate in their care plan meeting. Let me repeat that. The feds or federal regulations in the United States, I can't speak on Kenya, but we're going to find out after I say this. Federal regulations here in the United States require dialysis facilities to invite patients to participate in their care plan meetings. You should not sign off on these papers without having been involved in a decision process. Ask your healthcare team when they will be scheduling your care plan session, or ask to schedule one in the next month. Brother Moses, do they hold care plan meetings at your facility in Kenya?
Not really. They don't. They don't. Um, uh, and I guess this is one of the most important thing also by involving a patient. If there are patients that are facing some other challenges that can only be addressed by those patients. So if if for example planning of scheduling of patient sessions is done not involving a patient, then sometimes you can make a patient to be inconvenient. And what will this one means now that once the patient doesn't follow up with what he is intended to sign, then it will just be a paper. It will not be binding for both the patient and the facility. The rule of the house must be articulated clearly and into simple language so that both parties get to understand that, because there are experiences even that doctors have no idea of. But patient comes day and night with different present different experiences, and even treatment can be modified based on that. So, Brother Steve, I totally agree with you that it is very important to include patient
in the care plan meeting.
yes in care
Or
planning.
involvement, yeah.
Absolutely, yes.
All right, let's talk about this last tip, and that's dare to self-care. Dare to self-care. Now, what do I mean by that? Dare to self-care. Anyone, and this is what I meant when I was talking the other day about in the future here in the United States, as dialysis gets more decentralized, they're going to push people more and more to go home. And if you can't do it, they're going to get a CNA or a GNA. It doesn't have to be a dialysis tech. And that goes along with what I'm about to read. Dare to self-care. Anyone can do dialysis with proper training. Anyone can do it. Anyone. You don't necessarily have to have medical training. But anyone can do dialysis with proper training, even you. And if the brothers and sisters had that option in Kenya, I'm sure Brother Moses would take on that responsibility. But even you who's watching can do dialysis. No one would take better care of you than you. Let me repeat that. No one would take better care of you than you. Unless you enjoy the time you spend in the dialysis center and the people you spend it with, consider doing home dialysis. And like I said, Brother Moses doesn't have that option. But people have better outcomes with home dialysis. If that is not an option for you, and in this case, Brother Moses, or maybe other people watching this, if that is not an option for you, then take more control of the care you get in center. Take more control of the care you get in center. Now, what I mean, talk to your facility about learning to take your own temperature. You already get your weight, your own blood pressure. Clean your own access site. Learn to assess your access site, meaning to look, listen, and feel. You can also learn to pour your own needles at the end of treatment. Hold your site and apply your own bandage. You can also learn how to place your own needles, also called self-cannulation. Yes, you can do that. A lot of people don't know it though. However, your center should be willing to help you participate in your own care. They should. If they are not, you should ask why. Brother Moses, anything you want to interject?
Let me just add on this. I want to stretch on this point that anybody can learn the process of dialysis treatment. And I do believe this one now confirm to me that we should not be having a shortage. The most important thing, one as a warrior must really master the steps and control your treatment throughout your session, so that every step is taken with diligently and with the proper care that is required. For example, when it comes to cleaning access, it should not be done shoddily. Once you know that, bearing in mind, then emphasis can be laid, and it can also improve better outcome. So it's not about one fearing to speak up that this is just a domain left to medical professionals, say our nurses and doctors. Back to you, Brother Steve. Can't hear you. The mic must have been muted.
Oh, I'm sorry. My mic was muted.
Yeah.
So you didn't hear what I said. So
Yes.
now we're going to talk about some key self-management actions that one can implement. We already gave the tips. Now we're going to give you some action steps that you can do. Oh, I got the sound now. Thanks. Now we're going to talk about action steps that one can implement right now. Right now, if you're dealing with this. Number one, track and manage fluid. Weigh yourself, if you're not already doing it, weigh yourself before and after each dialysis session and keep a log. Keep a log to manage your pre and post weight so you know how much you gain between treatment. Know your dry weight. The target weight after dialysis and the fluid limit your team gives you. Normally, it's 1 to 3 liters between treatment. But know what your dry weight or target weight is. That's your weight without excess fluid. Drink slowly and limit high sodium foods. Salt increases thirst. Use strategies like ice chips, frozen fruit, or flavored water, non-sugar, to manage thirst. Report large intergalactic weight gains to your care team. So report large fluid weight gain between treatments to the care team. 2, follow diet guidelines. Work with the renal dietitian. Dialysis patients often need adequate protein to avoid malnutrition, but also need to limit sodium, potassium, phosphorus, and fluid as directed. Take phosphate binders with meals, snacks as prescribed to control phosphorus. Learn which fruits, vegetables are higher in potassium and how to prepare or portion them. Ask the dietitian for meal ideas that fit cultural, budget, and taste. 3, medication management. Keep an up-to-date medication list and bring it to clinic visits. Include over-the-counter drugs and supplements. Take medicines exactly as prescribed. Some medicines, e.g. phosphorus binders, must be taken with food. Others may need timing adjustments around dialysis. Avoid regular NSAIDs, which are non-steroidal anti-inflammatory drugs like ibuprofen or naproxen. Avoid those type of pain medicines unless your clinician says otherwise. They can damage remaining kidney function and increase bleeding risk. Use pill boxes, alarms, or apps to improve adherence. Ask the pharmacist about cost-saving generics. And then number 4, vascular access care. Fistula graft or catheter. Protect your access. No blood drawers, blood pressure cuffs, or tight clothing jewelry on the access arm. Check your fistula graft daily for a thrill, vibration, and listen for a bruit, whooshing sound, like I said earlier. If you notice no thrill, swelling, redness, warmth, pus, or bleeding, call the dialysis unit immediately. Keep catheter exit sites clean and dry. Follow dressing and shower instructions exactly. Report fever, chills, or unusual drainage right away. That may mean that you're having an infection. Okay. Number 5, peritoneal dialysis. PD specific self-care. Maintain strict sterile technique for exchanges. Follow training protocols exactly. Clean and inspect the catheter exit site daily. Report redness, drainage, or pain. Watch for peritonitis signs, cloudy, effluent drainage, abdominal pain, fever. Contact your PD nurse urgently. And then number 6, this wouldn't pertain to our brothers and sisters in Kenya, or East Africa, maybe some, but I don't know. Home hemodialysis and equipment. Complete training and competency checks before independent treatment. Perform regular machine maintenance, water quality checks, and infection control steps. Have an emergency plan and a trained support person available. Number 7, monitor symptoms and labs. Communicate early. Keep a symptom log: fatigue, swelling, cramps, dizziness, shortness of breath, changes in urine, or signs of infection. Bring questions to dialysis rounds or call the clinic. Early problems are easier to fix. Review lab results, potassium, phosphorus, albumin, hemoglobin with the team and understand targets. Number 8, stay active and manage overall health. Aim for regular physical activity as tolerated. Walking, gentle strength work, and stretching helps blood pressure, mood, and muscle strength. Get recommended vaccines, influenza, COVID, Hep B, when appropriate. Manage other conditions, diabetes, heart disease, and blood pressure control are essential. Number 9, mental health and social support. Acknowledge the emotional impact of dialysis. Depression, anxiety, and treatment fatigue are common. Seek counseling, peer support groups, or faith community support. Social workers can help with transportation, financial aid, and work accommodations. And then number 10, plan for travel and emergencies. Carry a dialysis ID card with treatment type, access information, and emergency contact. Arrange treatment schedules and transfer plans in advance when traveling. Know when to seek emergency care. Chest pain, severe shortness of breath, sudden heavy breathing, passing out, or uncontrolled fever. These are some symptoms that you want to report. When to call your dialysis team or seek urgent care. Signs of access infection, fever, redness, swelling, pus, severe pain at the access site, sudden loss of thrill, or audible bruit and fistula graft, severe shortness of breath, chest pain, fainting, sudden extreme swelling, or heavy uncontrolled bleeding. For PD, cloudy effluent, meaning the fluid coming out in the bag, severe abdominal pain or fever. So self-care is very important, self-care management. And what one can do, again, simple patient checklist to start today, way before and after dialysis, and keep a log. Bring an updated med list to your treatment. Take phosphate binders with meals. Avoid NSAIDs unless told otherwise. Check your access daily and report concerns immediately. Schedule a session with the dietitian or ask for one if you don't, or if you haven't met, with them. And last but not least, reach out to social work if you need help with transportation, benefits, or counseling. Brother Moses, I know I said a lot, but anything you want to comment on of what I just said?
Oh, yes. Let me just add on when one is a scheduler, an appointment with the doctor, it is important that throughout your stay at home, to ensure that you note down every detail that you get to experience as far as your health is concerned, and so that you don't forget. So when you go to the next appointment, you are able to, even to share with the doctor efficiently without forgetting any, because forgetting one might means that the one you've forgotten could be a game changer. You never know, because everything goes in silence. In the world of CKD, everything goes in the silence until it is a time bomb.
Yeah, you're
Back
right
to you,
about
Brother
that.
Steve.
You're right about that. And that's when everything comes to a head. And it could have been managed before that point. So On a final note, before we close the show, self-care management does not mean doing this alone. That's not what it means, doing this alone. It means informed, consistent choices supported by the dialysis team, family, and community. Small daily actions make a big difference in safety, comfort, and long-term outcomes for people on dialysis. With that being said, we hope you enjoyed this broadcast today. Again, we talked about self-care management for patients with kidney failure. Brother Moses, anything you want to say to the audience before we head out?
I want to thank everyone who is watching wherever you are for supporting this program. Always feel free to share your thoughts and expertise to this broadcast. We can even improve it better. And thank you very much. Keep watching. Same time, same hour. Thank you very much. I am your co-host, Moses Kennedy, your kidney ambassador.
All right. Thank you, brother. We want to thank everyone. Hey, Ms. Moore, thank you for coming in and supporting the broadcast. We want to thank everyone who stopped by and showed support or commented. Ms. Tabitha from Kenya, Kimberly Moore, somebody else I saw. Oh, Lawrence Hurst from the UK. My man Jared Brown out of Utah. And anyone else that's watching, we definitely appreciate your support and ask you to continue to come by each Sunday at 1 p.m. USA time and 8 p.m. East Africa time. With that being said, we'd like to thank everyone again for coming and supporting the show. Brother Moses, I'll see you next week. Thank you for coming on and your unwavering dedication to the show, despite your challenges that you deal with. So,
thank you.
Absolutely. With that being said, we see everyone later. We see you next week. Have a great week, and we see you soon. Thanks for watching. Peace.